You know, of the 12 cancer drugs approved by the FDA in 2012, 11 cost more than $100,000 a year. These are not cheap pharmaceuticals. And I'm going to turn the tables on you. Maybe it's a coincidence, or maybe these are just expensive technologies to develop. And unless you pay for that, nobody's going to develop them. Unless you got the $100,000 for a therapy that does seem to work, we wouldn't have it. How do you account for that in this model?
We'll see.
Okay.
Well, the companies will only develop the drugs if they can make money selling them. That's the system we have. I'm not protesting the system. I think the system works. But if the companies are convinced that at the end of the day they'll be able to sell the drug for a profit, whatever that may be, they will continue to develop new and innovative drugs that will benefit patients.
Mm-hmm. Well, you know, we've covered an awful lot of territory around here, and you've taken your hits.
I'm okay. I'm good.
I've noticed that too. It's been a delight to have all three of you here. And what I want to do is I want to go around the table and give each of you 30 seconds to a minute to share your final thoughts with us. And I'm going to give you the last word, so be prepared for that. So, Mike, why don't you start?
So, my thoughts are that in 30 seconds or less, immunotherapy has arrived. It's only going to get better. The best is yet to come for the field of immunotherapy. Americans will anguish, switching gears, about Obamacare, managed care, the future of being a physician. I don't think that much will change. I think there will still be a place for the great physician who has an intuitive grasp of what the best treatment for a patient is. I don't see how we're going to be hurt by being more data-driven. As a research oncologist like Dan, certainly we're more data-driven than most, but a lot of what we do is very not data-driven, and it's just seat of the pants. I think everyone will be better off, society, the patients, the insurers, when the practice of oncology, which we pursue, is done in a more rigorous and data-driven way. I don't have any problems with that at all.
Dan?
Yeah, I'm very excited about the future of immunotherapy as well. I agree completely with Jeff that the best years are ahead of us. I am a little bit concerned there is an educational lag, both for patients and for some providers regarding immunotherapy, how it works, why it works, and the benefits to it, and practice. And so there's still a learning curve there, like with any new modality. I think that's going to, especially now that it's branching into numerous fields and not simply a niche of oncology. I think we're going to overcome that, pretty quickly. And I look forward to being able to be smarter about how we use our immunotherapies, like with all our other therapies, and precision medicine helping guide us to who to give immunotherapy to and when. The concerns I have is that that'll never get us all the way there. There is always going to be a role for the oncologist to make individual decisions on patients, and we can't lose sight of that. We have to have mechanisms to do that. But no, I think the future is bright for oncology and immunotherapy in particular.
And as promised, you've got the last word, Mike.
So as both an oncologist and as somebody who works for a payer, but largely as an oncologist, we are living in a golden age. So much of work that has been done for a long time is coming now to fruition. We're understanding personalized therapy, we're understanding immunology. It is tremendously exciting. Some people might look at healthcare reform and grappling with quality and value as a hardship. It's an opportunity. It's a chance for oncology, for the pharmaceutical industry, for the entire healthcare enterprise to redefine itself, its opportunity. And at the end of the day, we'll have enhanced benefit for our members or our patients. We'll have more transparency, and it'll be driven by data. And I'm real good with that.
Well, I want to thank all three of you for being here. This has just been great. I want to thank you for watching. You know, it's unusual for me to insert an editorial of my own at the end of one of these, but I'm going to do this. This is a remarkable time. I have never seen so much excitement, so much real progress. On the part of oncologists before. This is a magical time. Immunotherapy is something that is just ridiculously interesting and ridiculously exciting. It is heading us where we need to go, and based on my experience in medicine, based on my experience with the folks I've met here, we're going to get there. Thank you very much for watching. I'm Dr. Peter Salgo. We'll see you again.